What can you do about chronic viral infections? Are they fixable? Are they treatable? One of our patients was like, hey, I've got an Epstein-Barr virus. And so the way you test for this is a medical, or excuse me, an antibody test. The test for Epstein-Barr, there's three different tests, but they basically look for acute, and has it been there for a while? And have you been exposed to it? The levels are supposed to be under 18, and the patient was, over 600. And this is so common to see. Now, I just want to talk about the family of chronic viruses. Epstein-Barr is a huge player. Herpes simplex 1, which is the cold sore virus, it comes up here. Usually people have a pH change and then they get a viral infection. That's one. The the chickenpox virus that later on can cause shingles is a big player. The hepatitis A, it's a foodborne virus, rhinovirus, rotavirus, parvovirus, cytomegalovirus. Like, a virus is a virus. So it's this kind of just, we don't even know if it's alive. It's the segment of proteins that tries to reproduce. It's so much smaller than bacteria. And, in the British Journal of Medical Practitioners, chronic viral infections can lead to neurobehavior, neurodegenerative, psychiatric, autoimmune, and fatiguing illness. So it can make the nerves behave differently. It can make them degenerate. It causes concerns with, anxiety, cyclic mood disorders, depression, and it's the biggest cause of chronic illness. And so what's the best way that we can handle chronic viral infections? Is we got to get people to be healthy. And so this was the whole, pandemic thing. There's so many millions of people that got exposed to the SARS-CoV-19 virus. And there was a lot of people that didn't have any problems. And then there was other people that got mildly sick and moderately sick and severely sick. And one of the things I wish we would have paid more attention to was, what's the difference between someone that got really sick and someone that didn't get sick? It's their immune system. And that's how we work with viruses. So in this particular case, the question was, what can you do about Epstein-Barr? And, is it treatable? And then, okay, so the first thing that I want to clarify is with these chronic viral infections, the chronic viral infections, like, they're there basically in your system, but you can totally be normal. So can you get rid of a chronic viral infection? Well, you can't really. That's like saying, I'm going to get rid of the herpes simplex 1, the cold sore virus. Like, there's a lot of people that never ever get a cold sore, but 100% of the population's been exposed to it. And the status of your immune system determines whether it's a factor or not. So can you get rid of Epstein-Barr? No. Can you make people normal? Absolutely. Of course you can. You can help them to be better. So I just wanted to kind of lay the groundwork for some ideas about chronic viral infection. So the question was, what can you do for Epstein-Barr? So this virus is notorious for causing fatigue and causing swollen lymph nodes. So what are lymph nodes? Lymph nodes are infectious processing centers in the body. So you have two types of immune system. You have a humoral immune system, which is all of your antibodies. That's basically stuff outside of the cell. And then you have what's called the cell-mediated immune system, and that's the white blood cells that are going to go and get stuff in the cell. Two totally different pathways. It's kind of why, antibodies and antibiotics and stuff like that, they don't really work on, antibiotics don't really work on stuff inside the cell. They work on stuff outside the cell. So we want to work on the immune system that gets inside of the cells and targets infected cells. So they call that cell-mediated immunity. And the biggest player, in my opinion, for that is the thymus gland, which is right here, frequently associated or confused with the thyroid gland, which is up here. So thymus is behind the breastplate of the body, also known as the sternum, and it helps white blood cells to differentiate. So we have these educated white blood cells that they're called lymphocytes, and they go out and they find these infected cells and they kill them. And they take the waste products and any of these antigen complexes and stuff over to the jails of the body known as the lymph nodes. So a couple of things that really help chronic viral infections. Number one, there's this Native American herb called lomatium. So lomatium is fantastic for viruses. And it's a wild crafted herb, which means you can't farm it. Usually found on the western facing slopes of the Sierra Madre Mountains. and it was brought into prevalence in the 1919 by a doctor named Krebs, who was assigned by the government to go out and to help the Native American populations to be healthy from the worldwide flu. And when he went there to this particular Indian reservation, the Washoe Indians in what northwestern Nevada, none of them were sick. And he was like, well, why? So we have this huge, arguably the world's greatest natural disaster, the 1918 flu. It killed somewhere between 50 and 80 million people. Would make people bleed from the lungs and everything. And the Native Americans were chewing on this herb called Lomatium dissectum. There's an extract from that I've used really, really successfully to go with chronic Epstein-Barr infections. This is something that I want everybody to have in their medical cabinet, because this is something like if there's a big infection that goes around and everything, we want everybody to have access to this. Okay, this is what it looks like. LDM 100. What this medicine does is it's fantastic for colds, flus, asthma. I've seen it work really good on warts, but it's my favorite thing for Epstein-Barr. And what it does is it really fires up the thymus gland and helps to clean out the lymph node. It's really not something that I take prophylactically or preventatively, but sore throats are really good. Shingles, it's really good for. Epstein-Barr, it's really good for. And so that's one. Now, the patient that I was talking to said was prescribed some monolaurin, and which I really, really like. That's a conjugated coconut oil. So you'll see that. Elderberry is really good. Let's see, garlic, and of course, vitamin C. But I like using this protocol. This is the gold for Epstein-Barr infection. And then you want to do something to drain the lymph nodes. I like using something called myosotis and echinacea. So those are two homeopathic drops. It's awesome to use monolaurin. It's good to use vitamin C or Immunoplex or Immunocal, or there's so many other things that help with the immune system, but this one is really, really effective for Epstein-Barr. Now, I need to tell you one little thing about that. One of the things that happens with Lomatium is a small percentage of people, I just need to read it here, can get a one-time detox rash. What happens is and it really depends on the person. Sometimes the body will go into rapid cleansing mode, and it kind of jams up the liver and kidneys a little bit. So the body uses the biggest organ to get rid of it. And what is it? It's the skin. So you'll start to push stuff out, and you can look like kind of like measles here. Let me see if I can bring up a picture to show you of one of my patients that went to Africa and didn't want to be sick. It's kind of funny and kind of sad. And what I mean by that is they went there, and it was right during the Ebola thing. They're like, I don't want to get sick. Tell me what I can do so they don't get sick. And I told them about this, and they literally said, hey, you know what? If a little is good, a lot is better. And so let's see if I could just pull this over. And anyway, all right, here is what it looks like. Now, this is a minor detox rash. He took a whole bunch of it, and this lasts about 3 or 4 days, and it's actually a good thing. If you have a chronic viral infection, if you have a sinusitis that just isn't responding, if you've got some bronchitis or something in your lungs, like this is one of the things I'm going to recommend that you can do at home. But sometimes it flushes all the toxins out. It's kind of like a forest fire. It burns everything up. And then what happens is it quickly relieves. And so this isn't permanent, but I just got to give people a little bit of a heads up. One thing that helps that is dandelion root. Dandelion root really helps to calm down the body. So kind of review everything on Epstein-Barr chronic viral infections. I'm going to ramp up the immune system, drain the lymph nodes with potassium hydrochloric acid, and use Lomatium, a lymphatic drainer, which is myosotis, about 2,000 milligrams of vitamin C, monolaurin or elderberry. It's really good, or Immunoplex. And then also you want to follow all the rules of health by lowering your phagocytic index. So let me kind of talk to that just for a second. And this applies to all sicknesses. In the immune system, as the body is circulating through these police officers known as the white blood cells, when the white blood cells come into contact with the bad guys, they literally engulf them and kill them. And what happens is eventually they turn into a pus cell and die. And they usually can ingest 16 um, foreign bodies or antigens before they turn into a pus cell. Literally, I think it's 30 minutes of ingesting a tablespoon of white sugar. That phagocytic index goes from 16 to 4. It literally decreases it by 4 times. So one of the things I tell people, like, sugar and sweeteners aren't bad. It's the kind of sugar you can have a raisin, you can have an orange, you can have, a smoothie, you can have honey. But if you take a refined white sugar, it gives the infection another lease on life. So anything chronic infection with colds, with flus, with viruses, not only do we want to ramp everything up, but we want to make sure that we don't give that virus any wiggle room. And so white sugar, it's called the phagocytic index, white sugar, artificial sweeteners, saccharin, NutraSweet, aspartame, in my opinion, lower that and make the body have to work 4 times as hard. This is one of the reasons with the pandemic why the predictor of what was going to happen to people was their blood sugar levels. The media wasn't talking about this, but we know that with runaway blood sugar levels, like, you were a serious risk factor. And this is one of the reasons why some people were really sensitive, other people weren't, because of the blood sugar levels. So that's a kind of a nice review on chronic viral infections. Yeah, there's totally things we could do outside the office, inside the office. My favorite things to do for chronic viral infections or acute viral infections is obviously IV vitamin C and the major autohemotherapy, where we pull blood out, we put it into a bag with a little bit of heparin and ozone oxygen combination. We hyperoxygenate the red blood cells, and we ran the red blood cells past an ultraviolet light. We can attach a photon of energy to each red blood cell. And as that starts to circulate, the body really starts to pass off the red blood cells to the body.